Okay, first, our tripod died, so I'd like to tell you about the medication. So for the cefazolin, we tried reconstituting it with the correct amount of sterile water, and which was 2.5 milliliters according to the book, and this made it so that all of it is not reconstituted. And I tried drawing back the medication and it just kept getting clogged and I'm unable to pull it back. So I have called pharmacy and alerted them of this, and I will continue on with the other medications. Okay. And we'll do hand hygiene one more time. And I will start up with the rest of my medications. Okay. I have already done my normal saline and I attempted to do my cefazolin. Now I will be giving my phenytoin sodium, which I need to give 2 milliliters of, and I double check the order to make sure I have it all right. Okay, 100 milligrams. So I will be giving 2 milliliters. Okay. I scrub the hub for at least 15 seconds. I currently have my IV infusion stopped, and I will remove any tubing. I'll put it over here. I don't have my cap, so ideally I would like to replace the cap. Then I get another alcohol swab. And a normal saline flush. I scrub the hub for at least 15 seconds. And make sure that my IV is patent, that it's flushing. It is. I bring over my medication. And I will make sure to push it over 2 minutes. I will verbalize pushing it over 2 minutes. And I will flush once again. now I will move on to my next medication, which is pantoprazole. And this one is 40 milligrams in a 10 milliliter vial, and it is also IV push. I double checked the order, and it says to get 40 milligrams, and it is in 10 milliliters. And so I'll be giving the whole vial. I'll grab some more filter needles. I will push it over 2 minutes. I have verified all of this from the book previously, and I have written it down. Okay. I will scrub the hub for 15 seconds. I'll attach my filter needle. There isn't 10 milliliters of fluid in here. It's supposed to be 10 ml. The vial is supposed to have 10 ml in it. Okay, I will call pharmacy and alert them that there isn't 10 milliliters, and for now I will have to say that I am giving 10 milliliters. I'll discard of my needle. I will make sure my IV is taken, and it is. And this medication I will be pushing it over 2 minutes, and I will verbalize pushing it over 2 minutes. And I will flush once again after. Then I'll be moving on to my next medication, which is phenatone, and I need 100 milligrams, and this medication comes in 50 milligrams per milliliter. I will double check on the MAR to make sure I have my information correctly. Okay, so I do have my information correct, and so I will be administering 2 milliliters. Again. Now I would start the hub for 15 seconds. We'll discard the needle. I will get rid of any air bubbles. I will put this aside, make sure my IV can flush. It can. Give me my medication. And this medication will be going over 2 minutes, and I have verbalized giving it over 2 minutes. And I will flush once again. medication. Now I'll be moving on to my aldosterone, which is 2 milligrams per milliliter. I double check that I have the right medication and the right amount. 2 milligrams per milliliter. This medication did not specify how much to give. I looked at the book and it said to give 4 milligrams, so I will be giving 2 milliliters. Start off by scrubbing the hub for 15 seconds. I had verbalized scrubbing the hub for 15 seconds. Get out my syringe. Attach my needle. I pull back 2 milliliters of air. Insert the 2 milliliters of air. I discard of my syringe. I make sure that my IV is taken. This. I give my medication, and this medication is pushed over 2 to 5 minutes. And I have verbalized it, giving it over 3 minutes. I flush again. And finally, I'll be doing my morphine sulfate. And this medication, I need 1 milligram every PRN for a pain rated 6 to 8 or more. And, let me say that again. I will be giving morphine 1 milligram, and this is for a pain rating of 6 to 8 every 6 hours. And I will double check that I have the right medication. Milligram. I will be giving 1 milligram of this medication. I have gotten a 1 cc syringe with 1 milliliter, so that it is easier to push as it is pushed over 4 to 5 minutes. First, I will clean the hub of my medication for 15 seconds. Okay, I've gone 1 milliliter. And since this is a high-risk medication, I will need a second nurse to verify my dose. One milliliter. We twist off the cap and discard of my needle. And I double check how long I should push it for. And I pushed it for over 4 to 5 minutes. And the patient had stated that they had an 8 out of 10 pain scale. So I would first see if my IV is flushing. And it is. Then I will give my morphine. I will push it over 4 to 5 minutes. And I have verbalized giving it over 4 minutes. And I will flush again at a very slow rate so that the medication does not go into the body too fast either. Now I will do my piggyback of ceftriaxone. The reason that I did this medication last is because it's incompatible with phenytoin. And so the phenytoin was a medication that said now, and I needed to infuse it first, while the ceftriaxone did not say now, so I waited till the very last one to give it. So now I will reattach my normal saline after scrubbing the hub. I could not find the cap of this, but if it was the real life, I would make sure that I have recapped this and have reattached my normal saline. I will turn my pump back on, and I will give my secondary tubing. I will get my secondary tubing, and I will go and double check that I have the right medication, which is ceftriaxone in D5W, 1 gram every 8 hours. IV piggyback and infuse over 30 minutes. So I would be infusing at a rate of 200 to infuse it over 30. And now I will prime my secondary tubing. Close my clamp. I will aim this higher. I will pause my primary infusion while I am trying to get this situated. I will attach my cushion here first. I will scrub the hub for 15 seconds. And I will attach my piggyback onto the Y side above the infusion pump. And I will make sure it is unclamped. And I will restart it. First, before starting it, I'll make sure to put in the medication, and this is ceftriaxone in 1,000 grams in 100 milliliters. Thousand grams. In 100 milliliters. And the duration will be 30 minutes. And now I have the infusions running at the correct rate. And I have my ceftriaxone going at 200 milliliters an hour to infuse over 30 minutes. And I have my primary heating underneath and the Y side at the right place. Okay. And now I will pause it. And that's it for all the IV medications. We can stop and start on the second part, which is all the subcutaneous and blah blah.